Each year, more and more adults are diagnosed with diabetes, creating a strain on our healthcare system and putting patients at risk for serious complications. The good news is that by changing your diet and exercising more often, you can prevent the disease or reverse its course. Dr. Lan Tran-Phu, Medical Director of the Cumberland County Public Health Department, talks about how diabetes is affecting Cumberland County residents and the preventive measures you can take before it's too late.
The diabetes type 2 is very prevalent now. The latest number that I have from the CDC, year 2008 in the United States for adult 20 years and above is 11% of the population, which is about 25.5 million people. And in the United States, with the age adjusted, meaning the overall number of people who are diagnosed with diabetes type 2 is 26,000 people here in Cumberland. When people are already diagnosed with diabetes, your physician can decide whether the person needs just oral medications combined with diet and exercise, or if the diabetes is very difficult to control, they can put you on insulin with very close monitoring of the blood sugar. So you have to discuss with your physician, and the monitoring has to be very based on your blood sugar levels. In addition to providing medical therapy in care for patients, mostly like, for instance, for the people who are uninsured, we also are building a whole program of diabetes self-management education to our patients. We have education session to our patients to teach them how to monitor their own blood sugar, how to monitor their feet to make sure that they don't have any lesions on their feet, and that can cause them to risk to lose their extremities. We can teach them how to calculate the calories that they can eat and prepare their meal accordingly. We can also teach them what the exercise that could be right for them according to their health status. So those education sessions are based on the two main levels of diabetes management. One is nutrition and exercise, like we aim at changing the behavior. The other one is the medical therapy. We will explain to the patient how to follow the medical therapy that is already prescribed by their physicians. And knowing with the insulin and the monitoring of the blood sugar, it's very difficult, so we organize a whole home program to help patients handling their prescriptions. Well, there is a phase before you can be diagnosed with diabetes. It's called pre-diabetes. So your physician might say that you are pre-diabetic, which means that your blood sugar is higher than the normal level, but not high enough for you to be labeled as a diabetic patient. So when you are at that pre-diabetic level, it is very important for you to increase your exercise regimen in order to lose 5 to 10% of your body weight, and also to change your diet, because pre-diabetes doesn't mean that you will have to have diabetes. You can prevent pre-diabetes to become diabetes by taking charge of your own health and changing your life habits, your life behaviors. And then in order to prevent the development of diabetes, also we advise to stop smoking, because the high blood glucose and high blood pressure can cause us to have increased risk of cardiovascular disease and stroke. So if you smoke, please stop smoking, because that will further increase your risk of stroke. To make a long story short, you can prevent diabetes two ways: both exercise, like 30 minutes of brisk activity, such as walking at a brisk pace every day, 5 days a week, and a healthy diet, avoiding high sugar content food and high fat food.